person can't communicate nothing. Looking away, leaving the room, or an expressionless face all communicates something, either desire to avoid contact or the person being uncomfortable. Every action communicates something. Pause for a moment. What is the person next to you doing? Is he grumpy or approachable? Is he distracted or paying attention? Nonverbal communication is relational. It helps us identify who we are. Nonverbal cues also define the kind of relationships we want to have with others. Business partners and friends both use nonverbal cues to show their attitudes toward each other and define how they want relationships to proceed. This is one reason why the ability to encode and decode nonverbal messages is so important for success, both in the business world and in personal relationships. Nonverbal communication serves many functions. Repeating. After giving instructions, we point. Substituting. Instead of saying, "I'm okay," we merely shrug. Complimenting. A puzzled expression is worn while asking for clarification. Accenting. We emphasize who we are talking about by pointing. Regulating. If we want to interrupt the conversation, we lean forward and make eye contact. When we are ready to let the other person speak, we use voice intonation to show it's the other person's turn. Contradicting. We send contradicting messages. For instance, we might raise our voice and say, "No, I'm not angry with you!" Deceiving. Nonverbals can show if someone is lying. For instance, we touch our nose or look away if we are trying to hide something. A few things need to be kept in mind when deciphering nonverbals. First, cultures attach unique meaning to nonverbal cues. Placing the thumb to the forefinger is a signal for okay in North America, but in France and Belgium it means "you're worthless." In Greece and Turkey, it is a sexual invitation usually meant as an insult. Gender also plays a role. North American females tend to make more eye contact than men, and North American men are more likely to lean forward and require larger amounts of personal space. At its best, nonverbal communication is ambiguous. A wink may communicate friendship, a simple thanks, or an eye problem. Kinesthetic body behavior includes body orientation, posture, gestures, face, and eyes. Body orientation is the degree we face toward or away from someone. Posture is the way we sit, stand, and carry ourselves. Healthcare workers should face clients directly. Leaning slightly forward will show the client that you care. Gestures include pointing, nodding the head, and waving. Healthcare workers need to remember that different cultures attach different meanings to gestures. Nodding the head may be interpreted as yes by North Americans, but it has entirely different meanings in other cultures. Facial expressions communicate many things, including pleasure, shock, and disappointment. Healthcare workers can help set a patient at ease by smiling.
In vocal communication, it is not always what we say, but how we say it. Paralanguage is vocal communication involving things like rate, tone, and pitch. For example, when I say fantastic, my tone conveys sarcasm, but when I say fantastic, my tone conveys happiness. People actually pay more attention to the paralanguage than to content. The tone of a doctor's voice is important because it will greatly affect how a patient feels. This is shown in the following clip.
The test results were negative. The test results were negative?
Touch communicates a lot. Factors that determine the intensity of a touch include how long was the touch, who was involved, what was the situation in which the touch occurred. For example, a high five signals friendship, but an eye exam is professional. Touch is also essential for a healthy development. Research shows that infant orphans die every year due to lack of physical contact. Clothing can convey everything from a person's educational background to their moral character. Appropriate attire is important in making a first impression, but becomes less imperative as time goes on. We often make quick judgments about a person based on their attire. Appropriate clothing is important when it comes to healthcare because patients tend to put confidence in professionally dressed physicians or specialists. Studies show, based on their attire, we would perceive the following individuals as shown below.
There are many external factors that help us communicate non-verbally, including distance, physical environment, and time. The distance people place between one another is directly linked to how we feel towards them, and can therefore communicate non-verbally how we feel. Edward T. Hall defined 4 distances: intimate, personal, social, and public. Intimate distance is usually in a private setting between people who are emotionally close. Personal distance is usually the distance between couples when in public. Social distance is the distance that people would normally have a conversation. Public distance is usually in a setting where one person is talking to a number of people, like in a classroom. Healthcare workers not only need to be within social distance, but also in personal and intimate distances. They must be able to exude professionalism and confidence in order to keep the patient calm and relaxed. Physical setting, architecture, and interior design can all affect the way we communicate. This is very important in a doctor's office. If the doctor's office appears uninviting, then the patient may feel uncomfortable and may not be able to communicate how they truly feel. On the other hand, an inviting doctor's office can make the patient feel at ease and more open to communication.